Hello, it's Dr. Nikki at All American Medical Supply. Today, I'll be explaining how providers can correctly prescribe continuous glucose monitors, also known as CGMs. CGMs provide patients real-time dynamic information about their blood glucose levels around the clock. These devices have become more popular and accurate over the years. The improvements have allowed us to manage blood glucose within the recommended TIR, time in range. TIR is the amount of time a patient spends with a blood glucose range of 70 to 180 milligrams per deciliter. TIR data provides a more accurate view of the day-to-day blood glucose levels for a patient. This is more effective than monitoring the hemoglobin A1C and leads to better management of the patient's medications and guidance for plan of care. Let's talk about the 6 criteria to prescribe CGMs. Patients must have a diagnosis of diabetes, either type 1 or type 2, require long-term therapeutic use greater than 30 days, check blood glucose levels 4 or more times daily with a home glucose monitor, receive insulin via injections or subcutaneous infusion pump, require frequent adjustments to insulin therapy, must be at least 4 years of age. In addition to this criteria, please note that patients with gestational diabetes or cystic fibrosis who have suboptimal glycemic control may qualify for a CGM. Ordering prescribers may be primary care physicians, nurse practitioners, or physician assistant working with an endocrinologist. If an endocrinologist consult is not available, the provider may still request a CGM and notate that within the chart notes. To submit a prescription for the Freestyle Libre 2, please include the following. Dispense Freestyle Libre 2 system, 1 transmitter with 4 sensors per month, diagnosis or ICD-10 codes, and the length of need. Please note, the patient or caregiver must have a smartphone to integrate the Freestyle Libre 2 CGM system. Along with the prescription, please submit the chart notes to show the medical necessity. Chart notes should reflect documentation of one of the following: hypoglycemic unawareness, recurrent hypoglycemia, recurrent nocturnal hypoglycemia, recurrent ketoacidosis, recurrent suboptimal glycemic control including wide glycemic swings. After 180 days, patients will require a follow-up with the provider to ensure continued medical necessity and to ensure approval under insurance. Once you've completed the necessary documentation, please fax or email it to us with the chart notes. Once you've sent the documentation, you can ask the patient to text "register" to 773-764-0184 to start the process, or have them call us at that number. Check out our additional videos on how to prescribe other items such as diabetic shoes. Be well.